Hello and welcome to this episode of Ask the Expert. My name's Dr. Matthew Beedman. I'm a clinical psychologist and I work at City Psychology Group. Today I'm going to be describing one of the more popular approaches we sometimes use with the people that we meet, called acceptance and commitment therapy, or ACT. ACT is a modern form of cognitive behavioural therapy, or CBT, which has been shown to be an effective psychological approach for helping people to manage depression, anxiety, psychosis, substance misuse, insomnia, and also in the management of long-term physical health problems. ACT has also been shown to help people quit smoking, change their eating behaviour, manage work-related stress, improve productivity, and is thought to be helpful in many other areas besides. ACT aims to help people to respond more effectively to unwanted thoughts and difficult emotions and physical sensations, so that people can stay on track, doing the kinds of things that really matter to them in life and behaving in a manner more consistent with the kind of person they really choose to be. Now, usually when people come to see a psychologist, they're hoping for help to reduce some kinds of unwanted thoughts, emotions, or physical sensations, and we can think of these as the problem. When the problem shows up, people often respond in a fairly automatic and understandable fashion, with certain behaviours designed to make the problem go away. For example, if I felt very anxious and worried, I might respond to these problems by avoiding certain situations, trying to distract myself from my worries and perhaps doing things that seem to bring some relief, at least in the short term, like avoiding going outside, for instance, or perhaps drinking alcohol. For anybody watching, it might be helpful to think about when your problems show up, and by problems I mean the kinds of thoughts, emotions, physical sensations that you may have been struggling with. What kinds of things do you notice yourself doing to try and control, reduce, or avoid these things? This problem-solving approach to unwanted thoughts and emotions is completely understandable and actually very similar to the approach that we take to physical health problems. For example, if you've got an ache, pain, or an illness, you'd probably go to your GP or hospital, and hopefully there'll be a medical treatment that can help to get rid of that unwanted physical health symptom. Now, when it comes to psychological problems, sometimes trying to avoid or control our experiences can cause even more problems. For example, if someone feels very anxious in social situations and has started avoiding seeing friends or not attending job interviews, or perhaps has begun to rely on alcohol to get them through parties or other social situations, then sometimes trying to control or avoid or fix anxiety in this way can cause people even more problems and have unwanted consequences. This is reflected in research. When people think or believe they need to try to control or get rid of a psychological problem before they can get on with living life, then generally this approach doesn't tend to work so well and can sometimes lead to people feeling even more stuck. Now, if this sounds like you, or you can relate to this in any way, then you're certainly not alone, and it absolutely doesn't mean that you're broken or wrong in any way. It simply means you've fallen into the very human trap of trying to use strategies that perhaps aren't working so well to get you to where you want to be. It's a bit like getting caught in quicksand. Our instinct is to struggle and try and help ourselves get free, and yet sometimes doing so can lead us to sink even deeper and feel even more stuck. So acceptance and commitment therapy, or ACT, offers a really helpful and alternative approach to helping you get unstuck and to move forwards. If you work with a psychologist who uses ACT, you can expect to spend some time looking very carefully at what it is that's really important to you and what you would choose for your life to be about. These fundamentally important ideas are then used as a kind of beacon towards which everything else is directed. When the way that you respond to difficult thoughts and unwanted emotions takes you towards those important things, then we absolutely keep on going. When the way that we respond to difficult thoughts and emotions move us away from what's important, then ACT offers a different approach. One of the ways ACT aims to help people respond more effectively to difficult emotions is by developing an acceptance stance or willingness to experience these emotions. Rather than trying to control, avoid, or push these feelings away, Willingness is about learning skills to open up and take those feelings with you as you move towards what's important. So rather than struggling against the quicksand, an alternative approach is to get into full contact with the quicksand and see what other ways forward we're left with. So the stance really is that these thoughts and emotions, physical sensations, can be really difficult to experience, and I'm willing to have them as I move towards what's important to me. ACT is both similar and different to CBT and mindfulness. One important difference to CBT is that ACT doesn't try to change or get rid of unwanted thoughts and feelings. As I said, it instead focuses on developing a willingness stance so that we can take those thoughts and feelings with us as we move forward, which can often be a much more helpful approach in certain circumstances. There's also a great deal of focus in ACT on the present moment. Rather than planning for the next week or thinking about the week that's just gone, the focus in ACT is deliberately on the present moment. So this emphasis on present moment awareness, noticing thoughts and feelings in the moment as they occur, is similar to mindfulness, and you'll no doubt get to practice a lot of mindfulness in ACT. But there's much more to ACT, particularly a much greater emphasis on behaviour change, doing things that move you towards the kind of life that you want to have or the kind of person that you choose to be. A number of our psychologists at City Psychology Group have advanced training and a wealth of experience of using ACT in their clinical work, with all kinds of people of all ages. We frequently work with individuals, couples, families, groups, and also offer a wide range of ACT-based workshops. Thanks for watching. If you have any questions that you'd like to see answered here, then please do email them to us at asktheexpert@citypsychologygroup.com.